Hello and welcome to EULAR TV 2026. My name is Pratasha Saha, a clinical research fellow at the University of East Anglia, UK. It's my pleasure today to be joined by Professor Leonard Calabrese, Professor of Medicine at the Cleveland Clinic, Ohio. Thank you so much for joining us today.
Hey, my pleasure.
So, you gave a session at EULAR entitled Inflammatory Arthropathies and Mental Health, Bridging the Gap. What would you say are the main reasons for why there is such a big gap?
Well, it's a fascinating topic and one that has been transformed in the past few years. I think our understanding of the immune system, the integrated immune response, has been totally uh, turned upside down um, through many observations of the brain immune axis. And my point this morning is that, it's no longer sufficient to examine the integrated immune response by looking at peripheral cells and components and cytokines and mediators, that the brain and the immune system are in constant communication, afferent and efferently, and that we should not be surprised at this juncture that patients with immune-mediated inflammatory diseases, RA, lupus, and beyond, have attendant symptoms, including disorders of mood, fatigability, neurocognition, sleep disturbances. This is not that you have two diseases.
Absolutely.
One is fibromyalgia, and that's not my problem. And you have lupus or rheumatoid arthritis. So the plea right now is to look at patients with an integrated perspective and recognize that regardless of the fact that we have all these incredible therapies, not everybody gets to target. And this session was about really taking a holistic view of patients in addition to our best therapies. It was very exciting.
Fantastic. And in terms of clinicians, it can sometimes be difficult to differentiate active inflammatory disease from, for example, overlapping depression, anxiety, or fatigue. Do you have any approaches that could help clinicians in navigating this uncertainty?
Well, over the past 7 or 8 years at the Cleveland Clinic, we have matrixed on a clinical basis PROs on every single patient for every single visit. So when I see a patient, I can see all their PROMIS scores, I can see their PHQ-9, I can see their RAPID, and I can look at their mental health domain and the functionality that they're experiencing, and within a second, I know something's changed palpably. And it's a great entree to saying, something going on here. The second point that I make is that for all rheumatologists, and perhaps maybe this is resonate with trainees and beyond, we're very good at talking to patients about their chief complaint, but we have to remember we have to talk to them also about their chief concerns, and that affects quality of life and all of those domains.
Fantastic. And thinking to the future, in the ideal rheumatology clinic of the future, how best do you think we ought to integrate mental health assessments? And you've mentioned PROs, for example, but are there anything else we could do in order to make sure we do the most we can for our patients?
No, I think that intake screening that is really a holistic approach, not just looking at tender and swollen joints. That's really important. And, that's the core of what we're shooting for. But examining quality of life, fatigue, physical function, sleep health. This is no longer, fancy or space age. This is what we should be doing. And I can tell you that within a year, AI will have this all incorporated, and we'll have a much better picture. And sometimes when I say this, they say, oh, yeah, you work at a big place and this is all worked out for you. I think that's coming for all of us, and I think it'll be a boost for patient care.
Thank you so much for those interesting insights. And thank you to everyone listening to EULAR TV. Please stay tuned in, and we hope you have a fantastic rest of Congress.